When it comes to children, every milestone matters. The first step, the first run, the confidence to move freely. For parents, even the smallest concern can bring a lot of worry. I'm Dr. Gaurav Gupta. I am a pediatric orthopedic surgeon who deals with kids and adolescents' bone and muscle issues. I run a clinic by the name of Child Ortho Clinic, mainly in Faridabad. Apart from that, I do visiting consultations in other parts of Delhi and NCR as well. I started my bachelor's in medicine from Ambala. It took 4.5 years and then 1 year of internship course I did. After that, I did my master's in orthopedics from Government Medical College, Amritsar. It was a 3-year training, and then I did my senior residency for 3 years in Delhi. So when I came to Delhi in senior residency, I noticed that even in my training and in my residency, kids were being neglected or ignored. People were more focused in joint replacement, in arthroscopic surgery, sports injuries and trauma. But kids were not getting their share of attention, and their problems were taken casual because they are not speaking. It's their parents who are coming for their treatment. So I felt that there is a great lacuna in this part of orthopedics, and then I found a right mentor who can train me. So that is how I chose pediatric orthopedics. I was with Dr. Ramani Narasimhan for 2 years in Apollo, where I had exposure of pediatric orthopedics. After that, I went to Ahmedabad for a year-long fellowship with Dr. Maulin Shah, especially in pediatric orthopedics. There I was trained in all pediatric orthopedic issues, and apart from that I got a super specialty exposure in brachial plexus birth palsy as well. After this I did a fellowship in Japan, and then I did an observership in Boston Children's Hospital, US. So when I went to Japan, I was exposed further to cerebral palsy, gait analysis, deformity correction and various advanced ways of correcting deformities like hexapod system. I was also exposed to alternate ways of treating hips without surgeries. Then I went to Boston Children's. It's a 200-year-old hospital dedicated for kids. There I was trained further in congenital deformities of upper limbs and lower limbs, in brachial plexus surgeries, in operating or treating kids' bone and muscle issues with minimal invasive ways, and with the latest ways of treating them in the best possible manner. The kids and parents who are visiting me should be comfortable. They should be as comfortable as they are sitting in their home. So I want to create a comfortable environment for them in my clinic. So for that I have included a kids play area and a kids themed waiting place. Then I try to do open communication with the family. I let them ask as many questions and as basic questions as they want to ask me. I try to give them enough time so that when they are getting up from their chair, they are satisfied and they have some clarity about their kids' issues. And I try to befriend with the kids so that they are comfortable and they allow me to examine them and they express themselves also. Parents these days are a lot more aware than they were before 8-9 years. Now they come with a lot of issues and they are more aware about their kids' musculoskeletal needs. So many times they come with basic issues like pain in the body of the kids, posture of the kids, their development is going at par with the other kids or at par with their age. Then they come with deformities or like things like bowing, knocking, or some congenital issues like tilted bones, deformed feet and hand, and various other bone and muscle issues which are bothering their kids. So I commonly treat all issues related to bones and muscles in kids right from their birth till 18 years of their age. They include a lot of congenital problems like club feet, developmental hip dysplasia, radial club hand, congenital knee dislocation, tibial hemimelia, fibular hemimelia, congenital femoral deficiency, cerebral palsy, brachial plexus palsy. Then I treat a lot of fractures like injuries in their bones, both upper limbs, lower limbs. I also see some rarer problems like Spengel shoulder. So these are the spectrum of disorders which I usually see. A lot of conditions in kids can be managed with minimal intervention or invasion if we pick them early. Like a child who comes to us within 1 month of delivery and who has a clubfoot can be corrected with only plasters and splinting. Whereas a kid who comes to us with the same problem at 3 years, 4 years will definitely need some surgery. I deal with all pediatric bone and muscle disorders, but my super specialty interest is in hip preservation surgeries for kids and adolescents and in brachial plexus burst palsy. So my treatment involves a lot of reassurance and counseling of the parents as well as grown-up kids. It involves a thorough and a clear diagnosis with what we are dealing with, and then the management part, which is properly explained to the family, whether it's a surgical route or it's a conservative route, what amount of time it's going to take and how the follow-ups will be, what kind of surgery, plaster, bed rest the child would need, and how long he has to follow up with me. I want to share this message with the families that if they are worried or concerned about any bone and muscle issue in their kids, they should come and consult with us sooner than later. Because if it is something which can be corrected, earlier the better. And if it is something which does not need any correction, it gives a lot of comfort and relaxation to them that the child is not suffering from anything major. So treatment is not just about correcting bones and joints, it's also about giving parents clarity and children confidence.